Hello, and thank you for tuning in. This is a live PowerPoint presentation of chronic disease schizophrenia disorder by Brian Haynes. What is schizophrenia? Today, schizophrenia is the 8th leading cause of years lived with a disability without medical diagnosis, treatment, or help. According to the medical journal BMC London, schizophrenia is a severe mental disorder characterized by fundamental disturbances in thinking, perception, behaviors, and emotions. Schizophrenia affects 1% of the world population. According to a genetic study performed by the Molecular Psychiatry in New York in 2006, research has marked out numerous biological indicators tentatively associated with the disorder. These include neurocognitive dysfunction, brain and neurochemical abnormalities. However, in contrast, the study has failed to demonstrate any specific gene variant or combinations of genes either necessary or specific to cause schizophrenia. The study design and specifications. Study design was a community-based cross-sectional study. The location was Febrit district of Amhara, Ethiopia. The start date was December 1st of 2016. The end date was February 1st of 2017. This was a face-to-face questionnaire with 5 socio-demographic areas, case vignette casual models questionnaire for schizophrenia, 36 questions. Responses were categorized into 2 correlating themes, traditional versus biophysiological. There were PAR measurements taken from 702 participants divided by 952 times 1,000 equaled a 74% PAR measurement. The total participants were 952, 545 were women at a 57.2%, and 407 were men, which was 42.8% to complete the 100%. Public health programs addressing schizophrenia disease. BMC reports, studies done in China promote mental illness recognition within rural areas exclusively targeting schizophrenia. Allocations listed an annual $2.5 million within healthcare budget for mental illnesses. The International Journal of Mental Health Systems London stated their expansion of public health insurance resources given high priority for mental illness, schizophrenia disease, tax-shared mental health care. More and more evidence is providing more funding for further investigation and treatment for patients suffering with schizophrenia disease. Interesting factors identified were, to my understanding, schizophrenia had been determined by physiological factors, and that the disease was genetically passed from one generation to the next. Clearly, that's not the case. The recent study done in Ethiopia showed a much higher prevalence of disease in women. In 952 studied, 545 were women, 407 were men. Genetic and demographic factors play a role in disease. Manifestation is most likely not witchcraft or God's will. With respect to other mental illnesses, schizophrenia, in the article published by the International Journal of Mental Health Systems, opportunities for improved financial and mental health crisis have been identified. The situation has a significant level of traction. Financial risk and exposure are healthcare system characteristics, and macroeconomical fiscal expenditures have been appropriated. Schizophrenia is a real chronic disease. Take aim, help treat, and be ever so mindful of schizophrenia. Thank you. This has been a short presentation by Brian Haynes on the disorder schizophrenia.